Imagine this. A tiny, fluffy baby llama cria, or maybe a delicate little deer fawn, orphaned, rescued. You see it snuggled up, bottle feeding, looking just utterly adorable. You know, the kind of picture that just blows up on social
Oh,
media.
yeah, absolutely. Heartwarming stuff.
But here's the really shocking, tragic reality that this often leads to. Extreme human-directed aggression. Aggression so profound it can actually be life-threatening.
It's a tough truth.
Yeah. So today we're taking a deep dive into something called Aberrant Behavior Syndrome. We're focusing specifically on these often misunderstood animals' camelids, so your llamas and alpacas and cervids, which are deer and elk.
Right.
Our mission today is basically to sift through this stack of sources we've gathered, scientific papers, vet analyses, detailed reports, all of it, and really pull out the key insights for you so you can understand this incredibly complex and, frankly, often heartbreaking issue.
And I think it's crucial we say this right up front. This kind of tragic aggression, it's not some innate flaw in the animal itself. Instead, what we're going to unpack today is how it's actually a predictable outcome. It stems from very specific human management practices. It's really about getting to the why behind what looks like this sudden, bewildering switch from, sweet to dangerous.
That's a really sobering setup. So if we're saying it isn't an innate flaw, how do we even start to wrap our heads around what's going on? Maybe let's start with the words we use.
Good place to start. The terminology itself tells a story.
Okay, let's unpack the terminology then, because you're right, it can be incredibly misleading. Lots of people have probably heard the most common term, but it's problematic. Berserk Male Syndrome, or BMS. This was actually introduced by a llama breeder, Paul Taylor, back in the early 80s. And it certainly sounds descriptive, doesn't it? Conjures up a pretty vivid image.
It does, yeah, very vivid.
But scientifically speaking, it's pretty inaccurate.
Precisely. BMS is just deeply flawed. It wrongly implies the condition is, inherent, specific to males, almost as if the animal just catches it somehow.
Right, like a disease.
Exactly. And that framing, it puts the blame squarely on the animal's nature. It totally obscures the critical role that human actions play in causing the behavior. It's a fundamental misdirection of responsibility, really.
Okay, so if Berserk Male Syndrome is out, or at least problematic, what's the term the scientific community prefers? And why is it better?
The preferred term is Aberrant Behavior Syndrome, ABS. This was proposed by Dr. LaRue Johnson, who's a really prominent camelid veterinarian.
Okay, BS.
And aberrant is the key word there. It correctly identifies the behavior as a deviation from what's normal for that species. It immediately shifts the focus away from, some flaw in the animal and towards the abnormal circumstances of how it was raised.
That makes sense.
You might still hear other terms floating around, too, like Male Aggressive Behavior Syndrome, MABS, or even, more colloquially, things like Rabbit Alpaca Syndrome.
Wow.
Yeah, and some behaviorists have even suggested calling it Novice Handler Syndrome, which really puts the focus on the human element as the cause.
And that's really the headline here, isn't it? This isn't about a bad animal. It's about a pathology shaped by humans. That's a profound takeaway right there. So with that new lens, how would you define ABS for our listener?
Okay, so ABS is best understood as an acquired behavioral disorder. It happens because of something called incorrect etiological imprinting.
Imprinting. Okay.
Right. Basically, the young animal comes to identify its human caregivers as if they were members of its own species conspecifics.
It thinks the humans are llamas or deer.
Essentially, yes. And this misidentification, it's typically caused by way too much handling over socialization during that really critical early learning period. Often it happens when the animal is also isolated from its own kind.
Gotcha.
So then the animal starts directing all those normal species-typical behaviors and things related to dominance, territory, mating competition. It directs them towards the humans it sees as part of its herd.
And just to be super clear, is ABS say, flu syndrome, a medical disease?
No, good question. It's definitely not a syndrome in that traditional medical sense. It's a predictable behavioral outcome, a pathology that arises directly from these specific improper rearing practices.
Okay.
And actually, using the syndrome label can be a bit problematic. It might lead to these self-fulfilling prophecies where an animal gets treated as inherently aggressive, which can kind of trap it in this cycle of mismanagement and escalating conflict.
This next point feels really crucial for understanding ABS properly. We need to distinguish it from other kinds of aggression, right? Just because an animal is aggressive doesn't automatically mean it has ABS.
Absolutely not. That's a critical distinction. There are many other potential reasons for aggression.
Like what?
Well, it could stem from a neurological issue, maybe a brain lesion or tumor, or chronic pain, think arthritis, fractures, internal diseases. Or it could just be normal social behavior for that species, like camelids spitting at each other or deer sparring during the rut. The key difference with ABS is the pathological misdirection of these otherwise normal behaviors specifically towards humans.
Okay.
Aggression can also be fear-based, defensive, related to guarding resources like food, and, importantly, it can be a symptom of infectious diseases like rabies. That's always something to rule out.
So given all those possibilities, how critical is a vet check if you're seeing aggression?
Oh, absolutely essential. You really need a thorough veterinary exam. That includes getting a detailed history, maybe doing neurological workups, blood tests, that kind of thing. It's critical to rule out all those other potential medical or physiological causes before landing on an ABS diagnosis.
Okay, let's connect the dots here. To really get why aberrant behavior syndrome happens, we need to dig into how animals figure out who they are. You mentioned etiological imprinting. Can you explain that a bit more?
Right. Imprinting is this really specialized, powerful form of learning. It happens during a very specific, sensitive time window early in an animal's life, often called the critical period.
A critical period?
Yeah, during this window, the young animal's brain is uniquely receptive to certain stimuli. It rapidly and often irreversibly establishes its sense of species identity. This is absolutely fundamental for survival.
How so?
Well, it teaches the newborn to recognize and follow its parent, learn the right vocalizations, the right social behaviors, and, crucially for the long term, how to identify suitable mates later on. It's all about knowing who am I and who are my kind.
And the timing of this critical period can vary a lot between species, can it?
Hugely. For precocial birds like geese, think Conrad Lorenz and his goslings, it can be just a matter of hours after hatching.
Right, the famous example.
Exactly. But for large precocial mammals, the ones we're talking about today, camelids, cervids, the sensitive window is much longer. It extends through the first days, weeks, even months of life. The highest risk for this maladaptive imprinting that leads to ABS is right after birth, but it stays pretty significant for up to maybe 6 months.
So what exactly happens when this imprinting process goes wrong?
Well, the mechanism of incorrect imprinting kicks in when a young animal, let's say our llama cria or deer fawn, is raised with excessive human interaction, especially if it's also isolated from others of its own kind.
Okay.
When that happens, it basically fixates on its human caregivers as the model for its species identity. The animal effectively comes to see itself as like a member of the human herd or family.
And that leads to this strange paradox, doesn't it? Because this whole pathway often starts when a baby animal needs to be bottle-fed for survival. But you're saying the issue isn't the bottle itself.
No, exactly. It's not the bottle or the milk replacer. It's the intense, frequent, overly familiar human contact that usually comes along with that bottle feeding process.
Ah, I see.
And this gets compounded exponentially by isolation. If that cria or fawn is taken away from its mother and its herd, it has zero opportunity to watch and interact with the correct social models. Humans become the only available parent figure, the only social partners.
So the natural question then is, who is responsible for this situation unfolding?
Yeah, and this brings us to this concept some people call the novice handler syndrome.
Novice handler syndrome.
Right. It highlights how inexperienced owners, often acting out of genuine compassion and a desire for a really close bond, frequently misinterpret those early behavioral signs of incorrect imprinting.
How so? What do they misinterpret?
Well, think about it. A young animal that shows absolutely no fear of humans, that actively seeks people out, maybe leans against them, lets you cuddle it, that's often seen as exceptionally tame, friendly, maybe even desirable, right? Like, oh, this one's so sweet.
Yeah, I can totally see how someone would think that's a good thing.
Exactly. But let's reframe this for you, the listener. Those actions, they aren't affection in the way humans understand it. Okay, so what are they then?
They are actually the initial sort of low-stakes probes of a young animal testing its social standing. It's learning the rules of engagement with what it perceives to be another member of its species, the human.
Wow.
So when handlers reward these boundary-testing behaviors, leaning, getting in your space with petting and positive attention, they're inadvertently teaching the animal that the human is a subordinate or maybe an equal peer. someone who doesn't command respect or enforce personal space.
And that seemingly innocent interaction when they're small.
Becomes the absolute foundation for potentially life-threatening aggression when that animal grows into a 200-pound adult. It's really a classic example of a negative human-animal relationship developing from good intentions.
That's really something. To really get how aberrant ABS is, maybe give us a quick baseline. How do these animals normally interact socially? Camelids first.
Sure. So camelids typically maintain a fairly linear hierarchy. They establish and maintain it through behaviors like neck wrestling, chest bumping, charging, and spitting, which is a very clear signal of displeasure or warning.
Okay.
Young animals learn their place within the herd structure pretty quickly, and they show submissive postures, like holding their tail up over their back to avoid conflict.
And cervids, deer and elk.
Cervids, especially the males, have more complex hierarchies. They often try to establish dominance through ritualized intimidation displays, first things like an eardrop or a hard look or sidling up to another male. They try to avoid physical fights if possible.
But they do fight.
Oh, absolutely. If the displays don't work, especially during the rut or the breeding season, it can escalate into violent physical combat using their antlers. And female deer aren't passive either. They'll use their sharp front hooves to fight for dominance or defend their young. Understanding this normal range of behavior really helps you see just how off ABS is because it directs these kinds of social competition behaviors towards humans.
Okay, let's transition now specifically to how ABS shows up in llamas and alpacas. You said it's a progressive spectrum.
Yes, exactly. What starts out looking like endearing friendliness in a young creepa predictably escalates into dangerous, potentially life-threatening aggression as the animal gets older. It's important to understand it's not a personality change. It's an escalation along a single, predictable path, driven by the animal trying to establish its social status with the humans it thinks are its herdmates.
So what does that escalation look like? What are the signs at different stages?
Okay, so in the early juvenile stage, let's say under 6 to 18 months, you see those warning signs that, as we said, are often misinterpreted as positive traits.
Like what, specifically?
Like a lack of normal wariness. The animal actively seeks out humans, maybe even prefers their company over other camelids. A really key sign is invasion of personal space, getting right in your face, constantly leaning or bumping against people.
Okay.
You might see inappropriate social testing, like mouthing or pulling at your clothing, or specific camelid dominance displays directed at humans, like flipping its tail up over its back or doing that U-neck posture when near people.
U-neck?
Yeah, it's a posture they use when challenging another camelid. And sometimes even misdirected reproductive behavior, like a male orgling, that's their guttural mating sound at a human handler.
Wow. Okay, so those are the early signs. What happens as they mature?
Right, so as the imprinted camelid reaches social and sexual maturity, usually between 1 and 3 years old, those hormonal drives kick in. They feel compelled to solidify their perceived dominant status within their human herd.
And that's when the dangerous aggression starts.
That's typically when it becomes really overt and dangerous, yes. And the aggression is characteristically aimed more at humans than at other animals. It's specifically social conflict with these perceived human herd mates.
What do the attacks look like?
They often mirror how male camelids fight each other, charging at a full gallop, ramming the person with their chest and knees, which can easily knock someone down, rearing up, stomping, biting. The animal might become highly territorial, screaming and spitting at people on sight or charging fences. Some might even try to mount people, especially smaller individuals.
And this can seem sudden to owners who missed the early signs.
Absolutely. If you haven't recognized that escalating pattern, these mature attacks can seem like they come completely out of the blue, without warning.
What's a critical indicator then for diagnosing ABS? Is there a specific tell beyond the behaviors themselves?
The single most important piece of the puzzle is almost always the animal's rearing history.
Right.
A background of being bottle-fed, orphaned, raised in isolation from other camelids, or just subjected to excessive handling, especially as a craria that's a massive red flag for ABS.
And behavioral observation.
Also crucial, yes, especially focusing on how the animal handles personal space. A well-socialized, normally imprinted camelid maintains a respectful distance. An ABS-prone animal will consistently, proactively invade your space. Observing those early warning signs, we talked about the tail flipping, U-necking, constant following, leaning, that's paramount for early detection. Owner education on correctly interpreting these cues is just so important.
Now let's talk about intact males. We mentioned the old name Berserk Male Syndrome. Is ABS really more dangerous in them?
It is, generally speaking. While ABS can definitely occur in both sexes, it's most frequently reported and usually most dangerously expressed in intact, uncastrated males.
Why is that?
Testosterone. It acts as a powerful accelerant for these aggressive behaviors. Plus, adding to the potential for injury, males erupt these sharp, canine-like fighting teeth around 18 to 24 months old. That gives them another set of weapons during an attack.
But it's not only males.
Absolutely not. That's why the old name was so misleading. Human-imprinted females can definitely develop ABS too. It might manifest more as chronic spitting, being generally unmanageable, maybe less of the full-on physical attacks than males, but still problematic.
Any other issues with females?
Yes, a significant welfare and production issue can be that imprinted females might actually reject male camelids for breeding. They see humans as their social group, not other llamas or alpacas.
And what about geldings, castrated males?
Geldings can also be affected. Castration can certainly help mitigate the hormonal drivers, especially if done early. But, and this is key, it's not a cure. It doesn't erase the underlying learned behavior if that imprinting and those social patterns are already firmly established.
Okay, let's shift focus now to the parallel situation in cervids, deer, elk, moose. You mentioned it's arguably even more dangerous.
I think in many ways, yes. The concept of the tame buck becoming a major public safety threat upon reaching maturity is well documented.
What's the core problem there? Is it still imprinting?
Yes, the root cause is the same. Imprinting, leading to a loss of the animal's natural wariness and fear of humans. It completely erases that crucial flight distance that normally keeps wild animals safe and away from people.
So the deer doesn't see humans as a threat anymore.
Exactly. When an imprinted buck no longer sees a human as something to avoid, but as a familiar entity, maybe a peer, a rival, even a subordinate to be interacted with, it transforms from this beautiful wild creature into a potential killer.
And this has led to actual harm.
Tragically, yes. There are numerous documented cases of serious human injuries and even fatalities resulting from attacks by hand-reared or excessively habituated deer. That's precisely why wildlife rehabilitation protocols strictly forbid practices that lead to taming, and why imprinted cervids simply cannot be released back into the wild.
You mentioned something earlier that really highlights the danger in cervids, the role of the rut. What exactly happens then?
Right, the rut, that's the autumn breeding season, and it's a period of incredibly intense hormonal activity and mating drive in males.
Driven by testosterone.
Massively. A huge surge in testosterone levels triggers profound physiological and behavioral changes. The male becomes intensely territorial, extremely intolerant of any rivals, and just single-mindedly focused on breeding. One source described a buck in rut as a crazed, hormone-driven breeding machine.
Wow.
Now, imagine that hormonal firestorm occurring in an animal that's already human-imprinted. The results can be catastrophic. Because the buck doesn't differentiate between a rival deer that wanders into its territory and its human handler, you have this lethal combination. A complete lack of fear of humans thanks to the imprinting, coupled with an overwhelming instinctual drive to fight thanks to the rut hormones. It creates an exceptionally volatile and dangerous animal.
And a key difference here compared to llamas is their weaponry, isn't it?
It is. That's a huge factor. While a llama attack using its body weight can certainly be severe, a male cervid is equipped with antlers.
Which is basically bone.
Yes, bony, often sharp extensions of the skull. They're grown and shed annually, and they specifically evolved for fighting other males. When an imprinted buck or bull directs its rut aggression towards a human, it uses the exact same tactics it would against a rival. It lowers its head, charges, and tries to gore, stab, and trample.
The force must be incredible.
Immense. Think about a large, muscular elk charging at speeds potentially up to 45 miles per hour. The penetrating power of those antlers can inflict devastating, often fatal injuries, and even female deer without antlers can be dangerous. They use their sharp front hooves like wicked weapons to slash and pummel threats, especially when they're defending their fawns.
And we've seen specific tragic examples of this play out. Can you share some that really bring home the reality of this danger?
Yeah, there are quite a few documented cases. One detailed account described a buck that was normally considered very sweet and tame, but once it went into full rut, it became relentlessly aggressive. It even tried to spar with a tractor, showing the unbelievable force involved.
The tracker, wow.
Yeah. In Franktown, Colorado, there was a case where a man was attacked by a deer that officials believed had been legally raised by humans, so likely imprinted. And even in professional settings, the risk is substantial. At the Salado Wildlife Education Center in Kentucky, a mature captive buck attacked several staff members during the rut. It took multiple people to bring it under control.
So it's not just about inexperienced owners.
Not at all. And it's not just bucks. We also see reports from suburban areas, parks, a female deer does attacking people, and pets. This happens most often during the spring fawning season when their maternal protective instincts are sky high.
So what's the common thread in these attacks?
These cases really underscore that the triggers are often those seasonal hormonal shifts. The rut for males, fawning season for females, combined with a human's presence being perceived as some kind of territorial or competitive challenge by an animal that has lost its natural fear.
Okay, what are the implications here? I mean, given the really grim prognosis for actually treating established ABS and these significant risks to human safety, where does that leave us?
It leaves us facing a singular overriding truth. Prevention isn't just, the best strategy. It's really the only truly effective and ethical one.
Prevention is everything.
Pretty much. The core of prevention lies entirely in modifying human behavior and our management practices. We have to ensure these young animals undergo normal, species-appropriate social development. And that often means handlers have to adopt what feels like a really counterintuitive approach.
So?
Resisting that natural human impulse to cuddle and nurture a cute baby animal, and instead actively enforcing respectful distance. This kind of professional aloofness, as difficult as it might feel sometimes, is actually the highest form of responsible care for these particular species.
So if the human handler is often, as you said, the #1 cause of these behavioral issues, what are the specific protocols for raising neonatal camelids? What does this hands-off approach look like in practice?
Okay, first and foremost, avoid excessive and improper handling. Crias, especially in those crucial first 4 to 6 months, should not be cuddled or treated like pets. Any handling needs to be minimal, business-like, and purposeful only for essential things like health checks or maybe specific training.
Makes sense. What else?
Prioritize herd integration. This is absolutely vital. Crias must be raised with their mothers and have continuous access to a herd of other camelids. That's where they learn all the correct social cues and behaviors.
So raising or buying a single llama or alpaca is a bad idea.
Strongly discouraged. That isolation dramatically increases the risk of them imprinting on humans instead. If they have to be separated temporarily, get them back with the herd as soon as possible. Sometimes putting a behaviorally at-risk juvenile into a sort of boot camp environment with peers can help recalibrate them.
Okay, what about boundaries?
Establish boundaries early and be consistent. From a very young age, the animal has to learn to respect human personal space. Handlers shouldn't be, polite and walk around an animal that's blocking their path. You need to make the animal move.
Ow.
Use a firm vocal command or maybe a gentle but firm physical cue, like a little knee bump to the ribcage, which actually mimics how camelids communicate dominance among themselves. Any unwanted approaches, like trying to jump up or lean on people, need immediate negative reinforcement. Like a loud no. Or maybe a quick spray from a water blaster, something to clearly signal that's not acceptable. And finally, prohibit hand feeding.
Why no hand feeding?
Because it directly encourages the animal to invade your personal space and creates this problematic association where humans equal food on demand.
Okay, that's for camelids. What about wildlife rehabilitators? What guidelines do they follow to stop fawns and calves from imprinting?
Licensed wildlife rehab centers operate under really stringent protocols specifically designed to prevent taming, habituation, and imprinting. The goal is always to ensure the animals remain wild and can eventually be released.
So what do those protocols involve?
Minimizing all human contact. It's kept to the absolute bare minimum needed for feeding and cleaning. Handlers are trained specifically not to talk to, stroke, or reassure the animals in a human way. They also house young animals with others of their own species conspecifics whenever possible. Raising a single fawn in isolation is just super high risk for inappropriate bonding. They often use remote feeding systems, too, so the animal doesn't even associate the food appearing with a human being present.
And public education?
That's a massive cornerstone of prevention for wildlife. Running campaigns like, "If you care, leave them there." Teaching the public that a fawn found alone is very rarely abandoned. Its mother is usually nearby. Kidnapping these fawns, even with the best intentions, is often illegal, and sadly, frequently ends up being a death sentence for the animal because it becomes imprinted or habituated.
That brings us back to that really tricky bottle feeding dilemma. When bottle feeding is truly unavoidable, maybe for an orphan, what's the goal then?
Right. In those unavoidable cases, the management goal has to be providing the essential nutrition while actively preventing the formation of a strong social bond with the human feeder.
How do you do that?
Professional guidance, like from the American Association of Small Ruminant Practitioners, strongly advises against any unnecessary bottle feeding, first off. If it's absolutely medically required, owners should work closely with their vets to minimize that direct human contact during feedings. Maybe the handler stands behind the critter area while feeding, or they construct some kind of hands-free feeding system. The critical concept, again, is that the problem isn't the bottle itself, it's the improper over-socialization that so often accompanies the feeding process.
So, pulling all these preventative threads together,
Yeah.
what's the single most potent tool we have against ABS?
Education, hands down. Owner education, breeder education, public education. Prospective owners must be thoroughly educated about the risks of ABS and the correct handling techniques before they ever acquire an animal.
And breeders have a role.
A huge ethical obligation. Responsible breeders should refuse to sell single animals, very young crias, or known bottle-raised males to homes that aren't prepared or knowledgeable. And these broad public awareness campaigns are essential too, to stop people from inadvertently rescuing healthy fawns and to promote respect for wildlife's natural behaviors and need for space.
Okay, but what happens when prevention fails or wasn't implemented?
Yeah.
When aberrant behavior syndrome is already established in an animal, what's the prognosis then? You've hinted the evidence is pretty sobering.
It really is. The overall prognosis for reversing established ABS is generally considered poor to grave.
Poor to grave, that's stark.
It is. There was a landmark survey-based study out of Iowa State University back in 2015. It found that all the reported treatment interventions people tried, things like behavioral modification, castration, even moving or isolating the animal, all of them had a higher rate of failure than success. Some sources, especially in lay literature, state flatly that once the behavior begins, it simply cannot be changed.
What about behavioral modification specifically, trying to retrain the animal?
Well, the goal of behavioral modification is essentially to retroactively establish that proper dominance hierarchy that should have been learned when they were young. But, and this is but it's an extremely high-risk endeavor.
Why high risk?
Because you're dealing with potentially large, aggressive animals. It requires a handler with deep, specialized expertise in herd animal psychology and managing aggression. It is absolutely not a task for a novice, and certainly not for the owner who may have inadvertently caused the problem in the first place. Any success is highly dependent on the trainer's skill and, frankly, how severe and ingrained the behavior already is.
Castration or gelding is often recommended, particularly for males. How effective is that really?
It's probably the most commonly recommended intervention, yes. And by removing the main source of testosterone, it can definitely reduce the motivation and the sheer intensity behind the aggression.
So it helps.
It can help, especially for a young male, maybe one that was overhandled and is just starting to show those early signs of aggression. In that scenario, gelding might be the single most effective thing you can do.
But, I sense a but.
There's always a but. Castration is not a behavioral reset button. It doesn't magically erase the learned behavior of imprinting or undo those established social patterns. If an animal has deeply entrenched ABS, the undesirable behaviors might not regress much or at all, even after gelding. And that Iowa State survey confirmed this. It found castration used as a treatment for established cases had a high rate of failure.
And this leads to that significant management catch-22 you mentioned earlier regarding the timing of castration, doesn't it?
Yes, it's a real dilemma for owners and vets. For the maximum potential behavioral benefit, you'd ideally want to castrate before puberty kicks in and before that testosterone really starts driving the aggression.
Okay.
However, testosterone is also essential for normal bone growth, specifically for the closure of the long bone growth plates. So, early castration, say, before 18 months or so in camelids can lead to these abnormally tall, often post-leg animals with conformational defects, and those defects predispose them to debilitating arthritis later in life.
Ouch. So for their physical health.
For optimal musculoskeletal health, vets typically recommend waiting until the animal is more mature, around 18 to 24 months old. But that delay means the animal experiences 1 or even 2 years of hormonal influence, which is exactly the period when ABS aggression typically emerges and becomes really ingrained.
So you're stuck choosing between potentially better behavior or better long-term physical health.
Exactly. It's a difficult risk-benefit analysis, and it powerfully reinforces why prevention avoiding the imprinting in the first place is so incredibly critical.
Are there any pharmaceutical interventions, drugs that might help?
Briefly, no, not really. While veterinary psychopharmacology is definitely a growing field, there's currently no evidence to support successfully using medication to treat ABS itself. Remember, it's fundamentally a learned behavioral pathology rooted in that misimprinting, not primarily a neurochemical imbalance that drugs could easily fix.
Okay. For the human-imprinted cervids, the deer and elk, what does long-term management look like if they can't be released?
For them, long-term management is almost exclusively focused on two things: containment and risk mitigation. Because, as we said, they're generally considered non-releasable and unsafe for the public to be around.
So, strong fences.
Extremely robust, secure fencing is non-negotiable, both to prevent escape and to protect the public. And strict handling protocols are absolutely crucial. There is simply no safe way for a non-expert to interact with a mature, imprinted buck, especially when it's in rut. Even in professional zoo settings, handling these animals is done with extreme caution, often involving multiple experienced handlers or even chemical immobilization using tranquilizers. Entering an enclosure with a rutting buck is potentially a life-threatening mistake.
So, given all this, what's the practical potential for rehabilitation for an animal with established ABS? Can they ever be fixed?
The literature, as we've seen, presents a somewhat divided view here. The rigorous academic surveys, like that Iowa State study, indicate a very poor prognosis overall and high rates of treatment failure. But you also hear from some highly experienced handlers, particularly those working with specialized llama rescues, who report that rehabilitation is possible for some aggressive llamas. They often distinguish these cases from truly berserk animals, which might have underlying neurological conditions.
So it's not necessarily a contradiction.
Not entirely. It likely reflects the critical role of handler expertise. Rehabilitation, if it's possible at all, seems to be a very complex long-term process requiring a professional with a deep, almost intuitive understanding of prey, animal psychology, and behavior modification. For the average owner, or even the average veterinarian who lacks that highly specialized skill set, the practical prognosis unfortunately remains overwhelmingly poor.
Which brings us to the ultimate grim reality for most animals with severe established ABS. What is it?
For most, the prognosis is grave. The significant and ongoing risk they pose to human life often leaves no responsible alternative to euthanasia.
That's tough to hear.
It is. The Iowa State survey found that euthanasia was indeed the outcome for the majority of the reported ABS cases they gathered data on. Similarly, for those hand-reared cervids, which can never be safely released or managed by the general public, the final outcome is often either a life sentence in a highly secure facility, if one is available and suitable, or euthanasia. This tragic end is really the ultimate consequence of that initial, often well-intentioned, but profoundly misguided decision to over-socialize the animal in the first place.
This paints such a bleak picture. What's the ultimate ethical quandary we find ourselves in with these animals?
It's this incredibly tragic circularity. It often starts with an act of human compassion, right? Saving a seemingly orphaned or abandoned baby animal.
Right.
But that very act initiates the process of over-socialization and incorrect imprinting. This imprinting then directly causes the behavioral pathology of ABS, which makes the animal dangerously aggressive towards its human caregivers. And then finally, this human-directed aggression often forces the humans involved to make the heartbreaking decision to destroy the very animal they once set out to save. It's a vicious cycle.
Let's put this into a slightly broader perspective. Aberrant behavior syndrome clearly extends beyond just being a tricky management problem for owners, doesn't it?
Sure.
It raises these profound questions about animal welfare and public safety, too.
Absolutely. From an animal welfare standpoint, an individual suffering from ABS is really in a state of deep and continuous compromise.
How so?
Think about it. They are fundamentally robbed of the ability to engage in normal social interactions with their own species. This leads to social deprivation, isolation. It's a chronic stressor. The inability to express their normal behaviors, combined with the constant frustration of trying to interact with humans as if they were conspecifics, it likely leads to chronic stress and anxiety. Those aggressive outbursts we see are really manifestations of this underlying behavioral conflict and frustration.
And a core principle of animal welfare is
allowing animals the freedom to express their normal range of behaviors. ABS pathologically subverts that entirely. And ultimately, the most common outcome we've discussed, euthanasia, represents the ultimate failure to provide for that animal's long-term welfare.
And turning to the human side, the public safety aspect.
The condition poses a direct, undeniable, and documented threat to human health and safety. We've talked about the documented injuries and, tragically, even fatalities, particularly with the cervids. Mitigating this risk really requires a multi-pronged approach.
Actually, yes.
Owner education on prevention is paramount. Strict safety protocols are needed for managing any potentially dangerous animals, for example. A common recommendation for handling adult male hoofstock is a minimum of 2 experienced handlers present at all times. And those public awareness campaigns are crucial to prevent the public from inadvertently creating more habituated or imprinted animals through feeding wildlife or rescuing fawns that don't need rescuing.
What about the legal and regulatory side of things?
Yeah, that's relevant too. In most regions, for instance, it's actually illegal for private citizens to possess native wildlife without specific permits, and that's precisely to prevent situations with dangerous imprinted animals arising. Wildlife rehabilitation centers are licensed and must follow strict protocols to prevent imprinting and ensure animals are releasable.
And owner liability.
Owners can absolutely be held legally liable for injuries or damages caused by their animals. The liability associated with an animal known to have ABS could be particularly significant. Furthermore, animal welfare codes generally place responsibility on owners to provide for an animal's fundamental needs, and that includes the need for normal social contact with its own kind. Creating an animal with ABS could certainly be seen as a clear failure to meet that standard of care.
Okay, let's look towards the future now. Can you offer a quick comparative synthesis? What are the key similarities and differences between ABS and camelids versus cervids?
Sure, the similarities are striking. The root cause in both groups is identical, that incorrect etiological imprinting on humans, usually stemming from bottle feeding and isolation. The primary trigger is over-socialization, often by well-meaning but novice humans. The behavior tends to be most pronounced in dangerous and intact males because of testosterone. And sadly, for severe established cases in both groups, the prognosis for a cure is extremely poor, and euthanasia is a frequent outcome due to the public safety risks.
And the differences?
The differences lie mainly in how the aggression manifests and the primary weapons used. The specific aggressive behaviors reflect their species' typical combat styles. So, camelids tend to charge, chest ram, bite, spit. Cervids, on the other hand, charge, gore with antlers, and trample.
Right, the weaponry.
Exactly. Camelids primarily use their body weight and teeth. Male cervids use antlers, which pose a much higher risk of serious penetrating trauma. And finally, while testosterone is definitely a factor in both, that dramatic seasonal nature of the rut in cervids creates this period of extreme, predictable, and incredibly intense hormonal amplification of aggression. That's pretty much unparalleled in camelids, making a mature, imprinted buck exceptionally dangerous during that specific time of year.
That's a really helpful comparison. Now, thinking about understanding this better, is there enough solid scientific research on this topic?
Honestly, no. The formal scientific literature, particularly concerning the general behavior and welfare of South American camelids, is often described as, well, scarce, dispersed, and frankly having less visibility compared to research on other livestock species.
So not a lot of controlled studies.
There's a notable lack of empirical scholarly research designed to scientifically validate many of the prevailing hypotheses about ABS. Much of our current understanding still comes from survey data, case reports, practitioner experience valuable, yes, but not the same as controlled studies. There's also surprisingly limited published research just on the normal behavioral reactions of camelids to routine handling.
So, for future research, what are the most pressing needs? Where should scientists focus?
There's definitely a critical need for more controlled etiological studies. We need research that can definitively identify and quantify the causal factors, and importantly, evaluate the efficacy of different treatment or intervention strategies, perhaps using prospective longitudinal studies that follow animals over time. Investigating the neurobiology and genetics could be fruitful. Understanding the neural circuits involved in imprinting and aggression might yield insights into susceptibility or potential future interventions, though that's likely a long way off. We also desperately need rigorous testing of behavioral modification techniques and controlled studies looking at the long-term behavioral and musculoskeletal outcomes of castration performed at different ages, tackling that catch-22 we discussed.
And welfare indicators.
Yes, developing more objective welfare indicators would be incredibly valuable. We need ways to objectively assess how different rearing systems, handling techniques, and housing conditions actually impact the animal's well-being. That would help inform best practices much more effectively.
This has been incredibly illuminating, if sobering. Ultimately, it seems aberrant behavior syndrome serves as this powerful and rather tragic cautionary tale about the real complexities of the human-animal relationship.
It really does. It clearly demonstrates that good intentions, while important, are simply not enough. A deep and genuinely respectful understanding of an animal's innate biological and behavioral needs is absolutely essential if we want to ensure both its welfare and human safety.
So here's a final thought for you, our listener, to mull over. As you go about your day, maybe consider how many other seemingly unpredictable behaviors you see in animals, pets, wildlife, livestock, might actually be predictable outcomes of our own interactions with them. And think about what responsibilities that places on us to truly understand the creatures we share our world with. Perhaps try observing the animals in your own life with a new, more informed perspective.